2:07 p.m. I'm going to call the committee of the Valley High Operating Committee meeting for January 3rd, 2025 to order. Can I get a roll call?
Hoff, Sullivan, Collins,
Here.
Reno,
Here.
Krager, here, Kaminsky, Shorten,
Here. Okay, we need a motion to approve the minutes from the meeting on October 1st, 2024.
Motion approved.
Got John, Terry seconds. Any discussion? All in favor say aye.
Aye.
Any opposed? Motion passes. And Kathy, if I need any roll call on these, let me know. 'Cause public comment, that's a no. Member comments. We have none?
Well, I apologize.
What's it?
It's okay.
It's all right. We'll talk to your source of truth later.
Oh, he already apologized too. It's horrible.
I just, real quick, we don't have the full board here, so I won't do a quick opening speech, but I kind of like to keep things moving, Robert's Rules of Orders and what have you, so, but we'll cover that at the next meeting.
Is this my pen?
Administrator's
It's not my
report.
pen.
All right,
You have the floor.
so before I get into the report, I just want to throw this out to our newer board members. This is really your report. It's what do you want to know, what do you want to track, what do you want me to report on? So this has kind of been designed off of what the previous operating committee was wanting me to report. So I'll just open this up to you guys. You don't have to tell me today at any point, but if you want different things added, or hey, Tom, we don't need to track this anymore, or you know, let me know. And this is not something that's locked in stone. We can change it. Maybe there's some of the things you might have a question like, why are you tracking this, or why is this important, or whatever. Please feel free to ask. I figure in that the first couple of meetings, there's going to be a little bit of an educational background and a learning curve for our newer board members, and then after that, we should be just hit the ground running at pretty much regular speed. So just please do not hesitate to ask, reach out to me, give me a phone call at any point in time. You know, if you get the report and you're like, I don't know what this means, or if you have any questions and you're getting from your either your colleagues or your constituents, don't hesitate to reach out. So let's talk a little bit about census, just so that everybody understands kind of where we're at, what the plan is. Our full capacity right now today is 80. Our license is 124, but we have all of the beds from the memory care unit offline right now, and then we have some of our rooms that are on the short-term rehab wing that are dual occupancy. We are operating those as private rooms, and so that takes the numbers down. So for now, until we open the memory care unit, just look at 80 as being 100% occupancy, and then figure at any given time, you've got 2 to 3 people that are in the hospital. So when you see on the report that the census is 73, and the report, it doesn't say that today's census is 73, and then it's +2, 75, that's kind of where, you know, like the report tells you what's in the building. It doesn't include what may or may not be spoken for and or who's in the hospital. So just kind of a caveat when you're looking at the numbers. So when we open the memory care unit, our full capacity will rise up into the 120, or actually be around 110. One of the things that we're going to have to do is come back and reduce our overall licensed bed capacity by 4. With the remodeling, we've lost 4 beds. So that's something we'll do on the back side of the memory care unit project. Otherwise, we will leave the rest of the rooms that are dual occupancy on the license. The way this works is that you are allowed to keep them so long as, at a moment's notice, you could put the room back in order. So what does that mean? You have a bed in the building, you have a wardrobe closet, you have a bedside table, and you have a call station that's available. Otherwise, you actually have to take them off your license. So the next logical question would be, well, then why don't we just take them all off of our license? Because beds are money. The asset of the building is based off of the total number of available beds. So if we were to go in and say we want our license reduced from 124 to, let's just say 100, just for easy numbers to work with, you're actually devaluing the asset overall. So we just leave it as the 128 or 124, and then you operate them less than that, and you staff to less than that. So just so that you kind of understand of why the number we're targeting is not the same as the license, is because not all of our rooms are being operated as dual occupancy rooms. There is some talk at the federal level of not mandating private rooms, but really pushing hard to having your entire building be private rooms. And there's a program that's been discussed in which that would become a financial benefit to a facility. So it's like a bed buyback program where you would take the bed off the licensed capacity, and then there would be some compensation back from that. One of the things that long-term care has to do is get a certificate of need if you ever want to build anything. In Illinois, the certificate of need process is actually skewed and broken because it's based off of the number of licensed beds in your area. So if you wanted to build another building, or when we were talking about the memory care, we had to file for a certificate of need. The area appears to have more beds than they actually do because almost everybody is operating their double rooms as privates, but they're not changing their licenses. So it looks like there's more beds in the area than that are being operated. So just one of those things just kind of keep in the back of your mind. So there's been this long history of Valley High having what is called a waiting list, and you'll hear that tossed around by a lot of legacy board members that have been there for a while, like what's the waiting list look like? It really creates a misrepresentation of what it is. It's a prospective resident list because you're not going to go next person in line. First off, you got to match the bed availability, male, female. Then you got to match the acuity in the hallway. There's just a lot of factors that go into that. So it's really not a waiting list as in you're number 2. So you'd be the next one in line. It's we have a pool of prospective residents and we're trying to do that delicate dance of matching them. So we try to stay away from the idea of it being called a waiting list, but like you guys asked earlier when we did a quick tour of the unit, do we have a waiting list for the memory care? Well, we definitely have a prospective resident list, but we don't know what the order is that we would bring them in because we don't know all their needs yet. So a little bit on the census piece. And I guess the last thing I'll throw out there is what drives the census. Most residents that come into the building come in on short-term rehab stay, and then they convert over to a long stay. And I'd say like 98% of all admissions start Med-A or like Med-A, so that Medicare replacement. And then we go from there. So even that, going back to that prospective resident list, those are typically individuals that live in their home or in another facility that are looking for a bed. Those beds are long-term beds, and the beds that open up more frequently are the short-term beds. So again, kind of getting into that ebb and flow. And then the last thing I'll say about census, and this would be the one area that I was going to focus kind of a little bit of some base knowledge at, is the different pay sources. So how does Valley High get paid? Well, we get paid privately, Medicare, Medicare replacement, managed care, Medicaid, and hospice. Those are the 6 payer sources that come into the building. You can be any one of those pay sources at any given time, and at times during the year, you might be one of different ones. So if you need short-term rehab, you would go into the short-term Medicare program, so that's either Medicare or Medicare Advantage. Once that stay is over and you need long-term care, you'd flip into either being private pay or managed Medicaid. So you could be any and all of it at the same time. You could be private, spending your money down with already Medicaid approval. We're just waiting to hit that threshold mark before you kick in. So when we talk case mix, we got to talk about it in terms of what is it today. So when we say, let's just say that the target is 20 private pay. If you guys say pull your private pay list and give us a list of names, it might have 30 people on there. You'll at any given time, you've got a set of people that are in flux from one to the other, and until they're into and completely approved in the Medicaid system, we have to count them as private pay, even though they're no longer paying. I mean, we're waiting on Medicaid to kick in. So just a little bit of census background and a little bit of financial piece. Any questions on any of that? Okay, good. Then let's talk real quick, staffing-wise. I made note that in November, we cleaned out our registry rolls ahead of the holidays. This is normal. So you'll see on the report that the overall staff, total staff went from 160 to 130, or right about that. That's because we cleaned out the registry rules. What we have is a requirement that if you're on registry, which means you're a pool employee, you don't have a regular schedule, you might work full-time somewhere else, you might be just looking for 1 or 2 shifts at your convenience, you have to work a minimum number of shifts per month or we take you off the registry. There's no sense in keeping them on the county's payroll. So when you look at staffing, we've got full-time, we've got part-time, we've got in-house registry, and then we have agency pool, which is, agency is contracted staff. And usually for long-term care and most healthcare, you're not looking at like a typical temporary employee you would hire for 30 days or 60 days or 90 days. This is done on a shift-by-shift basis, so they're only covering 1 shift in a period of time. Staff-wise for us right now, we're pretty well staffed at full. There's always going to be a small number of positions that are in flux, but for the most part, we have a lot of stability here in the building, especially your leadership team and some of your key employees. Any questions on staffing? Okay. Financial report is in your packet. Please note I did have an error in the administrator's report. On the revenue side, I overstated it by putting a 4 where the 0 should have been. It's just a typo. The report on the back is accurate, the actual P&L. So you can see where we're trending right now. You can kind of get a feel for where the year is going to end up. Right now, year-to-date net, when you put the investments in and everything, we're about negative 614. Please remember that we knew that this year was going to be in the red because we got half the building, not half, but a quarter of the building offline. But we're still operating a lot of our fixed costs. Like we didn't, we reduced nursing, but we didn't reduce housekeeping. We didn't reduce activities. We didn't reduce dietary staffing because it does take a certain number of staff to manage the department, whether we have X number of beds full or whatnot. So we knew this year was going to be a little bit of a rough one. But all the trends and all of the projections that once we get this memory care unit online, you'll see that quickly turn around. Go ahead.
Question.
No, fire away.
What's a premium discount?
Premium discount is that,
It's $140,000. Just curious.
that's our insurance, if I believe.
Oh, okay.
Let's see, we got their interest income. Scott, this is not coming from your side of the insurance, is it?
No.
Yeah, I'm gonna find out for 100% sure. I don't wanna give you something inaccurate.
Let me,
So I will report back to you on that.
Okay, thank you, appreciate it.
Yeah.
It's only a few months, but it just was.
Yeah, and I
It's-
can't remember what that actually ties back to. So let me find out for you for sure.
Okay, thanks.
Trying to think of any other highlights in the financial report that we want to toss out. I guess more importantly is you're not going to see another financial report for a couple months now. And this happens every year at this time of year. You'll get like a preliminary year-end report, but then we have to wait for the county audit, the external audit to be done, and then you'll get the final year-end report. And then all of a sudden you'll get like a real rapid catch-up into the next fiscal year. And then you'll start seeing a regular frequency. So they kind of ebb and they flow in the beginning of the calendar year, and then you'll get back to a regular schedule, and we typically are about a month or two behind by the time we close. Now, the one thing that I don't know how that's going to impact is we're moving the meeting to the end of the month instead of it being the first week of the month. So that might make the financial reports be a little bit more current when we get to the meeting because we'll have a little bit more data that we'll have the months closed. So that may change the pacing of this a little bit, but we'll see how that works out. Any questions on the financial report? I didn't want to spend a ton of time on that today because I think we're going to be rolling out another update to Scott's model here real soon. So I'll save that for the big show.
yeah, I'll just touch on this reference for the new members of the committee. Tom had thrown out a lot of information. We talked about bed mix, and we talked about staffing, and there's all these different variables that go into running this facility. And we had over the years developed this financial model, which really takes into account on a year-to-year basis the outlook of all the costs going in, offset by the revenues generated by Medicare, Medicaid, private pay, which are at different rates, And really, based on what the case mix is, based on and assumptions moving forward, it gives you as a committee and then the county board a good understanding as to how sustainable the Valley High facility is. And if all of a sudden, let's say it starts dropping down and the costs are not, keeping up with the expenses, before you deplete all your fund balance reserve, which is a little over 20 million right now, you'd want to make some decisions.
Just under. I have the new report.
Just under 20
Just
million.
under.
You want to make some decision to pull it out before it gets too far gone. So the whole point is for this facility to be sustainable, self-sustaining, so it's not reliant on property taxes. And in a financial report, you'll see there is a property tax levy because there is one on the books. And when you do the property tax levy each year, it's a very nominal amount. In fact, it's $10,000 in order to preserve that levy capacity. So you'll see it's a nominal amount. Back in the days when this was really relying on Medicaid, and Medicaid actually was, you had to subsidize that, the property tax levy was used to help subsidize that and also cover the cost of building this facility. We've since developed the financials to the point where with your careful monitoring of your case mix, your bed mix, you can now keep this running without any property tax levy, keep it fully sustainable. But it takes careful monitoring and looking at finances on a regular basis, and also too looking at other sources of revenue. And Treasurer Donna Kurtz has been very active in investing that money to try to get more interest, which is a source of revenue for the facility. The model, I think, does a really good job to simplify all that. And what's nice is we can run here and you can say, well, what if this, or what if that? What if we, in 2 or 3 years out, we change the bed mix to? I could show you instantly what that would look like and how that would change your financials. So.
Man, Scott sells it short, that the tool is amazing, and it gives us real-time
We should.
data to where you can pull one lever and see how it impacts, you can pull multiple levers, and we can do it all in real time. So, when we get probably another month or two down the road here, and we get that year-end picture a little bit clearer, we put that into the model. We got the new room rates, we'll have the memory care unit online, we can upgrade that, because one of the things that I've learned in the last couple weeks is that what we had built our modeling for the memory care unit room rates is actually too low. I'm being told that we're probably off by $100 a day, which the model does not reflect that, so that revenue is not even on the books yet. But we'll bake that in, and we can see. Maybe we keep the room rates as we projected, make that your low introductory rate, and then we raise them down the road. We can do that, and we can see what that does, not to just today, but to 5 years from now, and even beyond that. So it's a very powerful tool. So don't let Scott sell you short. I mean, it's impressive.
Great. Thanks, Tom.
So I'm gonna touch base on one last thing. The last page of your report that I emailed out this afternoon is the Valley High Fund financial report. Now, what that is that's the money. So the P&L is our operations. That's what normal everyday stuff. The second report comes from Donna, and she gives it to me usually on the second or third of the month. I actually have she sent it to me about an hour before our meeting. I have the new one for the end of the year. What she does is she details out for us where our money is that's considered the reserves. So I think Mr. Collins was asking a question about that report, so I'll just walk you through. Associated Bank, that's our cash. Schwab Investments is our total investment, so that would be any cash that's sitting there that hasn't been invested yet that Donna and her team are looking at investing, or the investments themselves. Donna Kurtz, Scott, myself, and her investment partner get together on a regular basis. We update our investment strategy, and we look at what is coming, big purchases coming down the road, and we make sure that we have the cash assets available for any of those big things that come up. Otherwise, Donna's investing them in various sources and whatnot, and keeping track of all that. So the report that you get on the back side has what are actual, when people throw around the word reserves, that's the number. So the new number is 19.8, and so it's a little bit lower than November. And why is that? Because we're paying for the memory care unit project out of our reserves, so we didn't take any loans No bonds, no nothing, we're just paying cash. We knew that it was gonna draw down over that period of time, so this number and this trending is not surprising, and that's why you don't see anyone, kinda like, why are we 900,000 or whatever the number is different than we were the month before? We're paying construction, we're paying FF&E, we're paying, the project cost, the architect and whatnot. You're gonna start to see that stabilize out here shortly. How you doing?
Patrick.
Where would you like me to sit? Anybody?
How about right there?
Okay.
As the memory care construction winds down, those expenses are already been paid for. You'll start to see that number, instead of each month coming down by a couple hundred thousand, all those expenses will be covered and it'll stabilize itself back out. Scott's model reflects all of that. And so we'll be able to show you, you can see where there's the chunk that comes down for the tax rebate, then it stabilizes out. The chunk comes down because of memory care, and then it'll stable itself back out again. So when we get to the model and the big show, you'll be able to see it, but this is kind of the background stuff. Did I answer the question you were gonna ask?
Yes.
Excellent. Cool. How you doing?
Better now. Oh, what other, I'm sorry.
No, fire away.
On ours, it says Bank of Oklahoma. Is that Schwab now?
So it's Schwab now, so.
Okay.
Donna just changed within the past, I think, 2 months or so.
Yeah.
Yeah, when
So-
she talked to us last month.
Yes,
Yeah,
that's
that's why I
right.
just wanted to make sure.
Yeah,
Okay.
my report will reflect that next month
Okay.
as we start to get, this is the first time her report said Schwab on it.
Okay.
But I didn't get it until, like I said, an hour before.
No, I assume that's what.
Yep, that's
she said.
exactly what it is.
Okay, perfect. All right, thank you.
Yep. So, and I think our next scheduled meeting is next week, if I'm not correct. Is it next week that we meet with Donna and,
Yeah, I believe so. Just the three of
I'm like,
us.
what?
no,
Okay, what I missed?
me and Scott, Donna and her investment
Okay.
partner,
Yeah.
like I said, we get together regularly to go through what do we need, what's available for investment,
It was not quite a year ago, Donna, Tom and I approached the committee, and Donna wanted to really talk about the investments and taking a lot of that cash, which was sitting in cash, and at that time generating really good interest rates of cash, but knowing that the economy was gonna change, interest rates were gonna change, and said we need to start preparing for taking the cash, putting it into investments, so it's gonna be stabilized and still gonna generate. If all of a sudden interest in cash drops to nothing, now we're probably gonna be missing out. So the strategy was discussed with the committee, and we sought the guidance of saying how much do we wanna have give Donna the ability to invest versus how much we want to keep in reserve and what that limit is, just to seek your guidance. And the commitment was we would meet on a quarterly basis and talk about where things are going, where they're at, if Tom has any big expenses coming up, such as pay request for the memory care unit or a capital project that's on the books that he knows he's going to pay for. We can tell Donna, you know what, don't reinvest this $200,000, we'll need that to pay off whatever the case may be. And that way we're diligently monitoring with every step of the way through the course of the year how the investments are performing against the needs of the facility to operate.
So when you talk about converting the three-season room to a four-season room, that would potentially come out of those funds based on everything else. Okay.
yeah, so the one thing that I do differently than probably every department in the county is that most of my stuff, the big projects, comes through a supplemental request throughout the year. Whereas we don't have, like Tom Burrows presents that capital plan, we have a capital plan. But then you're always gonna have things that come up as operating a facility like this that we can't wait for 6 months to the next fiscal year. We gotta make a move, so we just do them as either a supplemental, which we can know in the future, or an emergency appropriation. So you'll see a lot more of that through here than you would through any of the other departments.
And I think it's important to note too, you're gonna hear, when we talk about Valley High, keep in mind, it is its own fund. It is not intermingled with a general fund or any other fund. It doesn't compete with those other dollars. In the technical term, it's an enterprise fund. An enterprise fund is a governmental program that runs like a business. It has its own revenue stream, its own expenditure, and we keep everything really sequestered and contained, so it's all tracked. And so the expenditures that come out, the model is all specific just to Valley High, and it doesn't impact any other facilities. Even, so the risk management fund, which is one of the funds I handle, when we buy the insurance, which we just wrote the check and paid the bill, $250,000 of insurance, I bill that back actually to Valley High. So I send, anybody just an email saying charges, code a chargeback. So Valley High pays their own insurance, and they'll reimburse that insurance fund, so the general taxpayers aren't paying for that. It's coming out of the operations of Valley High. So, and I think that's important to note. It's because you'll be hearing about the different funds as you learn. Governmental accounting is all fund-based accounting. We have all these different funds, but it's all compartmentalized and for various reasons. So, Valley High is in an island on itself, and that runs through everything: staffing, all the cost and expenditures.
All right. Any other financial questions? All right, well, we're gonna look forward to the big show here in the next month or two.
Yep.
Legislative-wise, I just wanna throw two things at you. They both revolve around staffing mandates. One is the state staffing mandate, one is the federal staffing mandate. We'll take state first. So as you, most of you know, the state of Illinois implemented a minimum staffing requirement for long-term care a couple of years ago. And they didn't roll it out properly and follow the way that the law was written. So there was a period of time that they weren't allowed to implement the fines and the actual monetary part, but they still are required to do the notifications to facilities. Well, January 1, fines are now live. And so we got our first quarterly letter for the period of July 1, 2024 through 9/30/2024, and it was a zero fine letter. You're going to find that Valley High runs at a 5-star for staffing pretty much every minute of every day. So I don't anticipate that we're going to have any fines tied to staffing, but just throwing it out there, since the beginning of the program, the only time that it came up was there was a 4-hour window during COVID on the night shift that we didn't have enough nurse time because we sent the nurse home for failing the COVID screening, and we needed 4 hours to get the next nurse to back her up. We had a nurse, obviously we had a nurse in the building, but there was a gap, and I think the fine was like $40. It was back before they could actually monetarily do that. The only bad part about it is that for a quarter, you have to post, if you don't meet it, you have to post a sign at your front door that says, this facility fails to meet the minimum staffing requirement as per the state of Illinois. Doesn't say how many hours, how many days, how many minutes, how many staff, just has to post a sign. They tell you the font, they tell you the size of the font, they tell you the message on the sign. So we try to avoid that at all costs. One of the things that we do a really good job here is watch the acute, because staffing is tied to acuity. So we're watching the acuity rise and fall, and we're adjusting as it goes with. So there's never like that perfect, every day you know you're going to need X or Y. I mean, yeah, it's pretty stable here because we run pretty full. But there's a lot of factors that go into how many staff you're required to have. So we stay at that real high level. Now, the next piece is the federal staffing requirement. This is the current administration's kind of key piece of legislation on long-term care. The requirements are higher than the state of Illinois' requirements. So there are a couple states that have state staffing, and then there's this looming federal. 82% of the long-term care facilities in the United States do not meet the federal staffing standard. It's impossible. They don't take into account LPNs as if they're nurses. They count LPNs as if they're like some second-class citizenry. If you look at long-term care facilities across the country, LPNs are the backbone. RNs work in the hospitals, LPNs work in long-term care. So you're losing a class of counting towards your staffing of individuals. There's a RN requirement that you have to have an RN in the building 24 hours a day now. Not a problem for Valley High. But you get to rural Illinois where there's not a lot of RNs to go around, they can't meet the requirement. And so it's just a really bad piece of, well-intended, bad piece of legislation. There's a legal battle, there's a political battle, there's a legislative battle. It's like every angle to try to stop this mandate from going into effect in 2025. Illinois is one of 2 states where it's considered what they call a double jeopardy state, meaning you could get fined for not meeting the state minimum, which then also means you missed the federal minimum, and you get fined by the state and by the feds. In the end, what this legislation will do is just put a lot of struggling actors out of business, which in some ways you can argue that's a good thing, but when you're talking rural, long-term care facilities, that might be the only facility for 15, 20 miles. And the next thing you know, now you gotta drive an hour just to visit your mom. So, we're working through this. So what I guess the takeaway on this is, the state one's in effect now in full bore, we meet it, no problem. The federal one's coming, we don't know the status, we meet it in every category but one. Wouldn't be hard to get there, it's just a matter of saying, okay, we're gonna take on the additional staff and the additional expense of that, which for us would not be hard, it's just flipping a switch. But for other facilities, it'll be a harder thing. With the election, it is expected that this piece of legislation will die, and that there'll be something a little bit more reasonable that comes through. Like, most states need some type of minimum staffing requirement. I think we can all recognize that there is a minimum that you need to be at. Illinois is not one of them. Illinois and New York are the two double jeopardy states. They have their own state standard and then the federal one on top of that. So, more to come on that. I would imagine within the next 3 to 4 months, we'll know at least how one of those three legs, legislative, legal, or political, that change the outcome of this, and then we'll respond/react to that at that point. So,
Excuse me, Tom.
yeah.
Is that all self-reporting?
Thank you,
Yeah.
thank you.
So we have what's called payroll-based journaling, or PBJ. So we have to submit our payroll to the federal government.
Okay.
And then we also have to submit all of our staffing and census and all of that. And then they go through some algorithm and say, yeah, you missed that hour there, you missed that over there. And they send you a letter, basically, that says, well, thanks for telling us, and now we're gonna fine you.
Got it, okay,
Yeah.
all right.
Can't believe it.
So, like I said, though, you don't,
Gene,
typically, that's not something you gotta worry about here.
Sure.
so, it happened.
So I guess that brings us to, since we're talking about fines, to IDPH. So, our annual survey window opened up with the change of the new year. So what does that mean? It means that at any moment in time, we could have 5 to 10 surveyors walk through that door, and the world stops, and the survey begins. And the state is required to do a certain number of off-hour starts. So a typical start is either on Monday, and it runs Monday through Thursday, or Tuesday through Friday, right? The team is in the building. They have to do so many that start on a Sunday at 5 p.m., and they have to do so many that start in the middle of the night. Valley High is, I've been here almost 15 years now, we've had 2 Sunday starts, where they just walk through the door and it's go time. And how fast can you get all your leadership team into the building to manage the survey process? So we have begun the process of, we call it survey prep. We're ready for survey 365 days a year, because the state can walk in for any reason at any given time. So could the federal government if they wanted to. But there's always that period of time where you're in your window, and our window is January till April, that you just kind of crank it up just a little bit. You're a little bit tighter on some of your things that you're doing. You're talking with staff, because when the state walks in, they have the ability to go out on the floor, and this is what they're required to do, and ask questions of anyone, whether that's a family member, a resident, or a staff member. And they're taught to be kind of like gotcha, right? So they're going to try to get a CNA to say something that might not be accurate, or maybe speak a foreign language in front of a resident. Like, there's this one surveyor that does this all the time. She's Filipino. She'll find a Filipino CNA. She'll ask a question in Filipino, or Tagalog. The CNA will just naturally respond, and boom, gotcha for dignity. And so it's kind of a cat and mouse game. And we just take that week, we get through it, we'll get a report back, and then we respond to it, kind of whatever comes up. So any day now, we'll just get the start. You guys will get an email from me that just says, hey, FYI, we're go. And there's nothing you need to do, but then a couple days later, expect you're going to get an email from me that says, here's the results. This is what we're expecting to see from Springfield. Chair Shorten, on the other hand, he's going to be getting an email every day. Because what we do is in the morning, I send out an email to the team, and this is what I want you focused on today. At the end of the day, this is what we went on during the day. This is our recap. And we do this every day of the survey so that the team, we got 3 shifts. We got to have information flowing at all times so that the team stays informed. So more to come on that. IDPH will always be in the administrator's report, because you never know when they're in the building for something. We're required to self-report on injuries. So if a resident falls and sustains, maybe they need 3 stitches. We've got to self-report that to the state. The state then gets to decide if they want to come in and survey it, so to speak. Same thing with, if a family member, staff member, the ombudsman files a complaint to the state comes in and investigates that, whether they have any grounds, basis behind it or not. So we have about 6 to 8 surveys a year when you count your annual, your architectural, and any of the complaint ones that come in. So, any questions on public health or legislative? All right, well now I will wrap it up with real quick. I was going to do memory care, but I think we talked through most of that already. I'll just leave it as soon as I can confirm that our memory care unit director candidate has accepted the position, I'll let you guys know. That's kind of a Rubicon moment for us, because that's the moment we start the countdown to their starting, countdown to the programming being developed, countdown to getting the staff selected, countdown to opening. So that's huge, and I'm hoping to know before we go home today whether or not she accepted that position. So fingers crossed. Opening target, end of February, beginning of March. We're still on schedule. Construction looks on schedule. Wild card remains public health. They got to come out and do 2 surveys, a pre-occupancy and a occupancy after we've been operating the unit for a short period of time. We have sent the paperwork in to schedule pre-occupancy, but now we're at their mercy. So we'll wait and see the timing on that. That's really my report for the month. Any questions, thoughts, concerns, things you want me to cover next month that I didn't cover today? All right, well with that, Sir Chair, I am done with my report.
Thank you. Routine consent agenda, are there any items that anyone would like to remove? Being none, can I have a motion?
Motion approved.
Got a first, Mr. Collins, need a second?
I'll second it.
Tina will second. Any comments? Can we have a roll call, please?
Sullivan,
Here.
Krager, here. Reno,
Here.
Collins,
Yes.
Shorten.
Yes.
Yes, here.
Do we
Counts.
We need yeses, right?
My here's a yes. Sorry.
We had a, yes?
Yeah.
Yes.
Yes.
Did I say here?
Yeah,
Yes.
it's late on a Friday.
Motion approved, so there's no confusion.
All right,
Yes.
just so you guys know, this is the 4 resolutions are pretty standard. You're gonna get them pretty much every year. There's a couple more that are gonna come through. The way we do most of our contracts here is they're either 1 year or 2 years with option years. The big ones, we'll just call them the big 4, you're only gonna see once every few years. Therapy is contracted, pharmacy is contracted, medical supplies, not the little stuff, but I mean like the overall medical supplies and food. We do those for 2 and 2s with the idea that we're gonna be with them for the 4-year time period, especially when you're talking about pharmacy and therapy, because making a change is a significant process. But otherwise, everything else, you're gonna notice that I do almost everything split award. So there's multiple vendors available to us at any given time. And then, yes, we use purchasing, but I have somebody in my building that is kind of our purchasing person, and we shop everything. We shop food, we shop medical supplies, we shop everything. So when you see the split award, that's why we do it that way, and that gives us some leverage against, one versus the other as well. Pretty much kind of the standard way of going about it, so that's what these are. The only one that falls outside of that normal process is Dr. Egekezi, who's our medical director. He's an excellent medical director, probably one of the best I've seen in any of the buildings that I've had contact with. We like to keep him happy. He likes to be involved with us. He is very active, so you will see him around in the building. I'm surprised we haven't seen him walk by. He's here. He tries to get here once a week. His PA is here 1 or 2 days a week as well. So, I mean, at any given time, we've got direct access to Dr. E. Most of them, the staff go to see him in the community. I mean, he's a pretty big community doctor here in Huntley. But he's the only one that, it's every year. We don't go out to bid on that. We did when we first brought him in. We did not bid, but we interviewed. But as long as he wants to stay involved and he's as active as he is, we work with him to renew. The negotiation on the contract took about 25 minutes. And it usually happens over hot dogs.
Any old business? None? Any discussion items that we want to have on, for future meetings besides Scott's tool?
Well, I do have a question. And I know that I actually meant to ask you, Scott, before we had the meeting, but the funds for Valley High are completely protected. Nobody could access those funds or take those funds. I mean, it's by law, ordinance, whatever.
What do you mean by that?
I mean that another county entity couldn't come in and say, oh, they have a lot of money, we'll just borrow from them, the way they do with the general fund for Social Security and many other federal and state funds. And I just wanted to make sure that we are absolutely locked down tight here, that nobody can touch these.
I'm gonna have Carrie reach out to you. There's some nuance to that. You can do interfund loans for less than a year. And sometimes the county board can direct some changes. I mentioned that with the insurance, there's a chargeback, so that Valley High pays the tort fund for its insurance costs. There was talk a few budget years ago about using kind of I'm gonna say an administrative chargeback, because Valley High uses our county IT, county HR, and, you know, should they reimburse the general fund for that? So those are things, but those are board decisions, right? So you have that control, but this is your fund. And I think I'm gonna have Carrie reach out to you specifically on kind of the nuance about the interfund transferability. But it is restricted, but it's not restricted like some funds are very restricted, and you can only use like MFT. State statute says you can use it for only these few things. Valley High does not necessarily have those restrictions. They're more governed by you, but that's a high-level answer. Carrie Weiss, our CFO, can give you more of a specific answer.
Can we maybe have Carrie on the agenda for next month, or the next meeting?
Yeah.
Which I think is at the end of this month. Just kind of give an overview of that. Any other discussion items or future topics of concern? Don't think we need an executive session. So at this point, there's a motion to adjourn.
Oh,
John, first, Terry, second, all in favor?